Mr. Speaker, my point of order is premised on Order 8, Rule 46. Rule 46 to allow me to move a motion of under public importance and also crave your indulgence that all relevant laws be suspended to enable me to take it. I so submit, Mr. Speaker. The matter is on the need for sensitization awareness campaign and preventive measures of the outbreak of Zika virus from entering into Nigeria.
Presents the good people of Oshodi Solo, Federal Constituency, Lagos State. While seconding the point of order, Mr. Speaker, permit me to also extend the warm greetings of my constituents, whom one of them just put to bed this morning and named his son Dogara. Thank you so much.
Of the motion. I so support.
Those in favor.
Awareness campaign and preventive measures of the Zika virus outbreak from entering Nigeria. The House knows that the Zika virus, which is transmitted by a daytime active Aedes mosquitoes, was first isolated in 1947 and was named after Zika forest of Uganda, where the first case was recorded. The House further knows that since 1950s, it has been known to occur within a narrow equatorial belt from Africa to Asia. The virus spread eastwards across the Pacific Ocean between 2013 and 2014 to New Caledonia, the Cook Island, the Easter Island, and in 2015 to Mexico, the Caribbean, the Central America, and many countries in South America where the Zika virus outbreak has reached pandemic levels. The House is aware that the outbreak of the Zika virus has also given the global community serious concern, which has compelled the World Health Organization to declare a global health emergency on this regard, especially in the case where pregnant women are most vulnerable. The House is worried that the poor state of the primary healthcare facilities in Nigeria, which is already struggling to contain the recent outbreak of Lassa fever, will be stretched further with the added threat of this totally unfamiliar Zika virus, which cannot be prevented by drugs or vaccines. The House recognizes that it is imperative for those responsible for the immigration of people into Nigeria to undertake and initiate proactive measures to vet passengers coming into the country, especially those coming in from countries where this deadly virus is already present, in order to protect the health, safety, and security of Nigerians. The House resolves, 1, urge the Federal Ministry of Information to commence a massive sensitization campaign through the media houses, as this will enable Nigerians get educated on the dangers posed by this deadly virus called Zika. Second, urge the Ministry of Interior to make adequate provision for our immigration personnel at all entry points into the country with equipment and instant test kits to enable them prevent the incursion of this virus into our shores. And thirdly, mandate the House Committee on Healthcare Services to interface with the Federal Ministry of Health to start vigorous research on Zika virus with a final view of finding the cure of same and report back to the House within 4 weeks for further legislative action. I so move, Mr. Speaker.
Any second, Honorable Allegiance.
Is to second this very important and timely motion moved by my friend Honorable Emeka. Thank you.
Honorable Emeka.
Mr. Speaker, the Nigerian government will start to begin to act on proactive measures to prevent this virus from entering the shores of this country. Mr. Speaker, you will agree with me that recent times, the Lassa fever that we are experiencing now is giving a great concern to the Ministry of Health and Nigerians at large. Mr. Speaker, this virus, as we all see, is very, very, very dangerous to pregnant women. And there's cases that this virus has affected the mother-to-child disease transfer. Mr. Speaker, it is also important to begin to educate our people not to visit the countries that are associated with this Zika virus, because we stand the risk of importing it into Nigeria, and the outbreak will not be something to write home about. Mr. Speaker, finally, I suggest that also that Zika virus is being transmitted sexually. We also have people that have visited the country to test for this virus so that to prevent people from getting these diseases. Thank you, Mr. Speaker.
Any